Hello everyone, I am Dr. Guru Prasad Peruri, faculty of NEET-SS Pediatrics Nelson RAPIDO course. I am neonatologist by profession. I have done my pediatrics from PGIMER and neonatology from JIPMER. We all know the INICET, the common entrance exam for all the central institute super specialty is out. So now we have one of our student, Dr. Rohit, who stood All India rank 4 and rank 3 in AIMS neonatology super specialty. So it is very difficult to get through this exam, especially by hearing the success stories of these toppers. It would be helpful for the students who are preparing for the next time. So I took the pleasure of introducing to you our Dr. Rohit, who is our student. So basically, Dr. Rohit is from PGIMER. He did his MD from pediatrics. Now we will talk to him and let us know his success story in his own words. Welcome, Dr. Rohit. How are you doing?
Hello. Hello, good afternoon, sir. I am doing perfectly fine, sir. Thank you so much for calling.
Okay, how do you feel now?
Sir, frankly, I am still not able to believe, sir, that like for such a long time I prepared, sir. Finally, it is done.
Okay, understand in your mixed feelings right now. Just I would like to ask you some questions so that the students who are preparing for NEET SS or from future INICET will benefit from the success story of yours. Basically, where are you from? Where did you do your MD?
So, my native is from Ayodhya in Uttar Pradesh. I did my UG from Karnataka Institute of Medical Sciences, Karnataka, from Hubli. I joined in 2010. Then I did my MD from PGIMER Chandigarh. I joined in 2017 onwards, sir. I passed out in June 2020.
Very good, very good. Why did you choose neonatology as your super specialty?
So actually, in our department, in our MD time, so especially when we got a bit senior in our residency, so whenever posted in neonatology, so I used to feel that even with some simple interventions like simple mask, bag and mask, so we could see a drastic improvement in the outcomes, and the academic environment was quite good. The exposure was well, and the like teaching things were very good. And at the same time, during my residency and after that, at my native place, I have seen quite a gap in the practice. So, like some of the malpractices I have seen. So basically, this is the thing that which I found is that there is some knowledge and practice gap, and there is no neonatologist even for simple preterm asymptomatic babies. They have to refer to Lucknow, some 150 to 200 kilometers. So I thought of let's give a try to fill up this gap.
So great. Is this your first attempt, or did you attempt this exam previously also?
So I genuinely, with genuine efforts, I tried. This is the third attempt I had. Sir. I started from the last December, November-December session.
Okay. Like, what was your preparation strategy? Like, how did you prepare?
So for the general pediatrics portion, Nelson is the base which cannot be forgotten. This is everything comes back to Nelson only. For neonatology, apart from Nelson, especially for AIMS, so the AIMS protocol becomes very important, and Cohorty, particularly for PGI and JIPMER preparations, if we ask them from the previous pattern, and some other topics which are not covered in the book, I have to read, like apart from like a specific topics.
Okay.
To search on it or YouTube some videos. Then some people say Averys also I read, but not cover more specifically for doubt solving or some references which I am not getting some questions solved from the routine stuff. So that is it. And plus some websites like newbornwhocc.org from the AIMS and POSY for quality improvement. Some YouTube lectures for some topics if I feel like it was not covered, or maybe I am not getting enough uh, uh, understanding. So I used to refer something like we can search. So that was it.
Okay, good. Uh, During your preparation, by chance, did you think I am getting very depressed, or did you feel like why shall let us quit? Why should we waste our time? Something like that. And what kept you motivating for these three attempts like that?
So yes, this is not an exception, but probably a rule that rather all of us feel this one day or the another. I also felt depressed, like quitting like multiple times. Okay, I thought like let's do whatever I was doing, I can continue that only. But deep within the drive, what was the initial call or the initial thing what made you step into the arena? That call is actually important, which keeps you guiding. And the most important thing is the support, the family support, the friends, your seniors, your colleagues, your juniors. You keep on talking to them many a times. So even the seniors, they also say okay, कोई नहीं हो जाएगा, पढ़ते रहो. So just a simple push. Many of my colleagues are also preparing. They used to push me okay on many other days. So at the end, it's always a good thing to have a good support system, like who has seen you and like can push you from your like nadir of your preparation. Many times the things won't be the same. There will be odd days, there will be dark days, but somehow like this thing and your inner calling actually pushes you. Uh, so that is actually important, what I feel.
Nice. Suppose you're lucky enough to study in a central institute like PGIMER, okay. But there are many people or many students who don't have the opportunity of getting exposure to such specialities which are present in central institutes, and from remote places who do not have great teachers or great patients. Sometimes in private medical college, they may not have that many patients or academics going on like central institutes. So for such people, what advice can you give for them? That is my first question. Second question is, suppose some people have completed their pediatrics and might be working in private nursing homes and all. Do you think can they crack these super specialty exams? So what should they do?
So for the first question, I do accept that I was fortunate enough to be a part of a premier institute like PGI, but I was in touch in many of my friends from periphery colleges also. I do accept there are some like some limitations, but probably with the with the advent of COVID, especially, it's the boon that the digital learning platform has especially taken a quick pace. So, and in the, like even for me also, many of the online courses, webinar, and Telegram courses I have done, so which I could have not done otherwise also. So this thing is one of the very good what I can say, like driving force probably in the future also, which probably can help to this like narrow the gap. And if you are interested and if you find that the faculties or the exposure something is not up to the mark which you feel, so you can always go back to simply Google it, simply YouTube it. You will get n number of lectures. Like you can actually clear your doubts, give you better concepts, better exposure, case discussions, webinars, lecture, case series. So this is very important. Sometimes maybe yes, but this inclination that you have to overcome something which you are shorting of, and some direction, probably, okay, maybe you're interested in neonatology, maybe in cardiology, so that like approaching towards that, maybe you will eventually find some path one day or the other, or somehow. For the second part of the question, I would say
Like
yes.
for working pediatricians.
Yes, sir. It's like, yes, I do believe it's difficult. In fact, most of us are working or doing some kind of a job, and for most of us, it's not practically possible also to sit idle and read. Things are there. What I would say, probably a balance is a must. It's always, it's never too late to initiate a thing. Suppose if you are 30 or maybe 34, if you feel that I will prepare for anyways for 3 years, and I'll or maybe 1 year, and I'll do a course of 3 year, I'll be with suppose 36, 38. You will anyways will be 36 or 38, whether you do the course or not. But down the lane, if you put some effort, maybe you might find something. And first thing is, probably you should have your calling, and it's never too late to start. So we have so many examples in the past also, not in this, other fields also, people have started late, but for some it is late, for others, for that person it's probably on the time.
Okay, excellent, Rohit. That is very, really, really motivating for the working pediatricians there. Next, do you think these mock exams or MCQs or these online lectures which we are providing, do you think this type of things will work for the super specialty courses?
So
Like
yes, sir. Actually, those are very much important, because, like, in our UG preparation or PG preparation, most of us are used to give many of the mock test MCQs. However, in this situation, like, we are like working, we are more for, even if we are reading, we are more for reading rather than solving MCQs. So many other times, apart from simple acquiring knowledge, application, especially in those limited 1.5 or 3 hours, actually becomes really difficult many times, because you have to factor in your stress. You maybe you have not eaten well, you are stressed something, you have traveled so far, and you don't know the time management. You read something, and maybe you understand something else, you make silly mistakes. So these are the things, many of the things are actually factored in, and probably giving mock exams, and many times I would say even giving other papers, exams which are related. Even if you are not interested, or if you, even if you feel if you're not prepared for the exam, just please keep on giving whatever. Even if you feel, if you're working somewhere, it's a good idea to write on exams, some PDCC, PDF, SRship exams. uh, Suppose if you say, okay, I am not prepared for the NEET, I will prepare for next time and give. But it's always a good idea to give today, and the mocks are very, very important. They actually help you in the exam scenarios.
Yes, yes, I agree with you, Rohit. Most of the students, though they get enrolled, when I ask them, they usually say, "Sir, I am not confident to give exam at the time, and my preparation is not to the limit. I would like to give it in the next time." That is a common mistake everyone does. Who knows? This is a relative. No, exam is a relative thing. You cannot give 100%. So if you perform better on the day compared to others, it is that you get the rank and get into it. So you should not miss an opportunity of writing exams, even if your preparation is completed or you have just started your preparation. Whatever it is always better to give an exam. So that point is well taken. uh, and I would like to ask, like, how did this our NEET RAPIDO ADRPLEXUS help you for
So
getting into the interview or any other things?
so apart from the mock test, so what is provided? It's one of the very important thing is the interview portion. So because when I was prepared, when we got qualified and called for interview, so many of our colleagues who were qualified, I talked to them. So most of us were clueless, including me. So we don't know what to read, what questions will we ask, how to approach that, how much to speak, and how to when to stop saying, okay, this is it. So this is what I felt, that sir took the like the mock interview for those who got selected via video conference, and we had a long discussion. What all the topics are important? What are things which should be focused on? What we can leave? How is the case scenario they is given? How what to be asked in Viva and for the OSCEs? So most important thing is that sir himself has done his DM from the Central Institute. So that exposure and the like course what he has taken. So this experience actually has helped us, me and like many of the colleagues who have appeared for the like mock interview. So
Okay,
I'm
okay. Thank
thank
you,
you.
Rohit. Thank you for your kind words. Actually, it was very easy because I went through all these things like AIMS interviews, JIPMER interviews, all these things. So I have an idea, and my students keep on touch with me, and they keep on updating me with what are the things going on in the central institutes. That is how it was possible for helping you out. I think it has helped you during the interview. And the interview process also, I felt somehow it was my sixth sense, or somehow I felt you'll get selected. Luckily, it happened. I didn't tell you previously. So, which institute is your preference now? Which institute you want to join? So many people want to know that thing.
Sir, as AIMS Delhi does not have a seat this time, sir, my first preference will be uh, PGIMER Chandigarh. Second will be AIMS Jodhpur. And third will be JIPMER Pondicherry.
Okay, okay, good, good, good. We wish you'll get your institute, you'll get it in PJ or at least in AIMS, or but definitely it is your fourth rank. So definitely you will get whatever you want. We hope you will get which place you prefer. So next, would you like to give any advice for those who are preparing now for the INICET or appearing for NEET SS? Is there any difference in preparation, do you think?
Sir, there are some differences what I observed and like talked to many people. So INISS or previously like separate exams like AIMS, PG and JIPMER. So there are a lot of specialty portion. So PG and JIPMER has already 50%. AIMS does not have specific, but more than that, around 60 to 70% they ask the specialties. So in that specialty actually becomes really very important. So apart from the general pediatric portion, you have to be thorough with your specialty for like NEET, sorry, for INI, the neonatology, the textbook, and whatever like exam oriented topics, even suppose not in the textbook what we are following. So those things gets important. You have to be picky. Okay, this is the thing which has been asked repeatedly. Suppose some peripheral sphere, some quality improvement, some biostat. Suppose aim focus on. So you have to, okay, it's not there. I have not read, but I have to find out somewhere. Okay, it's on the net. So you get some PDF, some textbook, some short or long presentations. So you have to focus on specific those things more. So sometimes the book also becomes different. So like for NEET preparation, most of the things are covered by Nelson. However, for INI or AIMS, so they ask like more from their protocol book. Some flow art is more focused in PGI and JIPMER. So these are the things like this is some deviation. Then more practical aspects and case scenarios are asked more. Live situations, look, these are the vital parameters, this is the case situation, what will be the next step you will do. It's more like what you actually do or what you will be facing. Need is focused more textbook based, however they are also evolving their pattern what I have felt. So more going into the practical scenarios, and uh, the focus, main source is Nelson, definitely for pediatrics. Some outside things may be asked, but almost all the things are covered from Nelson. So and rather than topics, like you have to be very thorough with the Nelson, specifically for the NEET, and like very thorough with even the small things like epidemiology, prevalence, prognostic factors. You cannot skip that. So this is one of the things that, like, I found a bit difference.
Okay. So suppose any advice you want to give for those doing MD pediatrics, like just joined, so who in future may want to take some super specialty or something like that. For them, do you want to give any advice?
So I've seen myself and many of the juniors, and I've found the difference that probably, and many people I've talked to. So what I feel, if you prepare and initiate earlier, at least in the mindset, so things become relatively clearer and easier. What I feel. Suppose thing is you have to do your residency well, no matter what. Then it's not all already always about like reading. So most of the things you will be doing practically, and you will be in the wards most of your residency. So uh, just don't only treat patients. Go try to go behind the curtains. Just think for the pathophysiology, how the things are done, how like what are the instruments, how the disease process evolve. So this basic pathophysiology understanding, prognosis and management is always in the front seat. And apart from that, what I feel, simultaneously just observe things where you are getting more interest. I inclined more towards neonatology towards the end of my residency. So probably became easier by the time I finished my MD. Okay, that I am going for this thing. So what I feel is I started preparation after my MD. So you can not I cannot say start prepare and your MD, but at least have some inclination. Okay, I am liking suppose cardiology more, endocrinology more, and simultaneously if some specific books are there and you feel suppose Nelson, you feel that is not providing you suppose sufficient information, or you feel that something else is required, some guidelines, some small textbook. So probably you can focus on that. Like for neonatology, IMS protocol and flow hertier, like very good. They are not very lengthy books. However, those are very good and precise for the exam preparation. That's what I can feel.
Okay, great. Just one more last question. Do you think, like while writing the exam, like final exam, or before going to the exam, so what advice you will give to the students for them to face the exam? So what should be running in their mind? So how some people may get tense and all. Especially, how did you write the exam, and how did it work for you?
So I would like to divide in before the exam and during the exam sessions, and after that. So before the exams, even like suppose 10 to 15 days, I was like really tense because I had a pile of things to be read. I think I read long time ago and not revised. Even if I am reading, I am forgetting again and again. So but somehow towards the exam I somehow made a peace with myself. Okay, well, I cannot finish everything before the exam. The preparation cannot be 100% complete, even for the toppers. And the understanding, then you do not need to score 100% to qualify for an exam or to get a seat. And the have confidence in yourself that whatever you have read is enough, and you have to be be confident in whatever you have read. So and at the end you will if you have read and revised it and have a little peace of mind, you will eventually recall it, and like you will find the answer among those four options, one thing. So uh, this is what probably I felt after giving my exams, and probably this like mock exams also helps. One thing. Second is time management. This is very important because in the previous exams Like I was almost running for the time. Just I marked somehow. I finished something. Some questions I had to leave or like marked. I cannot review most of the things. Though, so I found out, okay, this is one of my weak points, and I have to work on it. So that's why, like, mock test help you. You have to manage your time. This is the most important thing in it. And so I can say not a tip, but like it depends on how you can approach. So what I did, my target was that suppose in 1.5 hour INI paper, so you can divide. Okay, I'll just quickly go through the questions in 1 hour in my first attempt, and I won't judge myself that whatever is there is right or not. Oh, I don't know even this much silly question, small question. So don't be too much judgy about yourself. The exam, just okay, ठीक है, आता है, okay, ठीक है, नहीं आता, छोड़ दो. So by the end, probably in 80 questions, if even if you have done about 25, 30 questions, 35 questions, 40 questions. So the good thing is just do quick things. And even if you think of this question is wasting time, this is too lengthy, and you do not want to waste time, you can just, okay, I'll see later. Thing is, if you finish that in 45 minutes or 1 hour, maybe 1 hour, 10 minutes. So by the second quick, you see the question again. So in those 25, 30 minutes. So thing is, you have already seen the 80 questions, you have analyzed the options, you have gone through the data provided, the parameters provided, and once again you go back, you will always be wiser. So that is what I felt. Maybe this you can save time and you can stop wasting unnecessary time. Maybe some lengthy numericals, and you will solve that question, but you will waste 10-20 minutes maybe down the lane. Then same 1 mark question, you will leave 5 questions. This is one thing. And many times, if you have that confidence, okay, I have finished my paper once. The second look, okay, so you will have some calm in your mind. You will be more relaxed. Okay, I have done it once at least. I have seen all the questions. So this thing is probably next time when you see the questions, many of the things you have seen, you have read it, but you cannot discriminate the options. So this time when you see, okay, maybe you have better chances that you will able to mark. This is one thing, but the most important thing is that you cannot lose your time, because if like you have to be really quick. This is what I tried. I've asked, like I've seen many of my friends do it, and probably that has helped.
Yeah, that is the strategy most of us do. Just go through a paper once, answer all the which are your confident ones first, then moderately confident next, difficult you leave at the end, and at the end you should decide whether if you are having a negative marking you would want to go or you would not want to go. At that moment you should decide. That is how it works. Okay, Rohit, it was very nice talking to you, and most of your information which you have provided will be taken for from the ADRPLEXUS side also to prepare the course for the students for preparing for the next time. And I hope your tips and advices will help the students who are preparing for the NEET or the NEET INICET for the next time. Hope you all the best for the future. Thank you. Nice talking to you. Bye, Rohit.
Thank you so much, sir.